One of the most frequently asked questions about what I do here that is so different is, do I manipulate? And when people talk of manipulation, they're talking about a thrusting manipulation, a forceful manipulation of the spine or any of the bones in the body or the joints. And I don't do that. I take a very holistic approach when I look at you. For instance, you may come in with a knee problem, and I may actually go right to this part of the pelvis because the pelvis is not lined up, and that's making one leg strike the ground a little differently and actually causing a knee problem. But the techniques that I use are very gentle. So whether you're here for a neck problem, a shoulder problem, a hip problem, a knee problem, everything I do is very, very gentle, and I use your muscles to make the correction. If something is not where it belongs, if something is just slightly off and the muscles are a little too tight, instead of trying to force them to go back, I use a contraction to get them to calm down. So for instance, if I had evaluated the shoulder and found out that the shoulder was not gliding properly and it was binding up as she was trying to use it, and I'd pick it up and she'd say, ow, that hurts, I'd say, well, let's bring you up to the point where it first binds up, it kind of feels restricted, and I'll have her pull down with just a pound of pressure. That's all you need to do this. The nervous system resets the muscle. And then after 10 seconds, relax, take a nice deep breath, good. And now I notice, wow, I can move all the way up here, and hey, wait a minute, then now it binds up here a little bit, a little restrictive, and I'll have the patient pull down for just 1 pound of pressure for about 10 seconds. And when that 10 seconds is up, relax, and I'll have them take a nice deep breath, and we'll follow it all the way up until I get where I need it to go. And then I say, okay, well now, I can just do this and say, all right, it's just binding up just a little bit there. I feel this where I'm palpating here, where I'm poking, and have them pull down with about a pound of pressure. Don't need any more than a pound to do this. And after 10 seconds, they release it, they take a deep breath. Good, and I do a couple more repetitions of that until I get them all the way out. She pulls again until I get them out to the full range of motion that they need to perform properly. And release and take a deep breath. Good, excellent, okay? So now, what if I found a problem with the hip? In my evaluation, I'll have the patient lie down, and I found out that the hip couldn't move the way I needed it to move. So for instance, I'm testing, and I find out that, wait a minute, this hip is restricted, and this one goes way over here. Well, I obviously got a problem with this hip, so what I can do is go out into that range of motion and say, okay, go ahead and contract that muscle for me with just a pound of pressure for 10 seconds, and after 10 seconds is up, I'll have them relax, take a nice deep breath, good, and then I gently move it out again, and now I get a whole bunch of extra movement out of it, and I say, all right, she's a little restricted, so I have her contract the muscle again with just a pound of pressure, hold it for about 10 seconds, and then relax and take a nice deep breath, and I'll do this a couple more times until I get my full range of motion that I really need to get them equal to the other side. Many times there's problems when I'm working with someone's neck, and of course you've probably seen pictures of people snapping necks. I won't do anything like that. What I may do is find the neck that doesn't move in the position I want it to, and then I'll find that position and I'll say, just contract that muscle right there into my hand, just for a pound of pressure, that's all you need, and after 10 seconds, relax, deep breath, and I just very gently stretch until I get that neck to go the full range of motion. And then when I'm all done with that, I'll go back and make sure that all the joints are moving the way they need the joint to move. But again, I do it without any manipulation whatsoever. I use the patient's muscles, and really rarely ever more than 1 pound of muscle contraction, and never any forceful thrusting or manipulation. And that's one of the things that sets me apart from other practitioners.